Hello, everyone, and welcome to the Strength and Hormones podcast. I'm your host, Lauren Papanos, and today we are going to be talking about fertility acupuncture. And I'm so excited to introduce you to our guests. We have Emily and Ghoncheh from Aphrodite Fertility down in San Diego, and we are going to be answering some of your most asked questions that you've submitted. So thank you so much, Emily and Ghoncheh, for being here. I'm really excited for our conversation.
Again, my name is Emily, and I founded Aphrodite Fertility Acupuncture, and we specialize in women's health and fertility, not only the education behind hormone regulation and cycle and fertility health, but also Eastern medicine and how it can integrate really well with Western medicine and your attempts at fertility, pregnancy, and postpartum.
That's wonderful. And I know it's such a niche within the acupuncture space and such a great service for women. And so I'm really excited to learn a little bit more too about some of the science of how acupuncture works for hormone regulation and for fertility. I think that our listeners love the science and the why behind things. So I'm really excited to talk with that a little bit more. Ghoncheh, why don't you tell us a little bit about you?
Thanks, Lauren. So happy to be here. So I am an integrative fertility acupuncturist and chief operating officer here at Aphrodite Fertility. And like Emily was talking about, we really want to reach as many women as possible and to really hear their fertility story, because women are coming in, they're isolated, they're not getting a chance to really share what they've been through. And so we really tried to provide a safe space for them to share their story and for us to provide the kind of integrative support and curated plan for them moving forward to get them to get pregnant and stay pregnant and bring home their healthy, happy baby. So that's what we do here at Aphrodite.
So why don't you just give us a little bit of an intro, Emily, to what is acupuncture in general and how does acupuncture work?
When you rub your hands together, it creates a heat, right? So movement creates heat. Like you can get behind that. When you run, you sweat. So the organs move. So your heart pumps and your liver filters and your lungs expand. And so there is a heat coming off of those organs that's not really accounted for in Western medicine. And heat is energy, right? Like when you turn the burner on the stove, it boils water. And so we call this heat or this energy chi, okay? And just like blood vessels and nerves, this heat coming off of the organs flows in certain patterns in the body. And so, for example, the heart heat comes off the heart and flows down to the inner aspect of the arm into the pinky. And so if the heart itself, the organ itself, or its heat pathway become dysregulated in some way, let's say either deficient or in excess, so like inflamed or stagnated, you'll have a certain set of symptoms. And so what we do with acupuncture is we go in with the needle along the organ's pathway, and the needle itself is almost like, it doesn't feel like a bee sting, but it is almost the same reaction as a bee sting because it's a foreign body entering the body. And the body responds. So it sends blood and lymph to the area, which can bring up any deficiencies, push through any stagnations, or bring down inflammation in that heat pathway. And so then the organ and its pathway can resume optimal health. And so that's how acupuncture can play a role in optimizing the whole body and all of the organ systems together.
Wonderful. So it almost sounds like kind of what happens in exercise where you get like a micro tear, right? And then all of the resources divert to that area to be able to essentially like upregulate healing. And can you tell us a little bit about how does acupuncture affect the nervous system? I know that there's a big connection between the two and that the nervous system is very interconnected with our hormone regulation, right? So can you tell us a little bit about how acupuncture affects the nervous system and then why that's important for hormones?
Totally. So there have been many studies on how acupuncture can regulate stress. And when we're talking about the nervous system, generally we're talking about stress regulation. So there are two key aspects of the nervous system. There's the sympathetic nervous system, which is your fight or flight, and your autonomic nervous system, which is your rest and digest. And so when you are in stress, as everyone is throughout the day, your fight or flight responses go into effect. And so that's fast heart rate, fast breathing, that's alertness, and which is fine. Which I want to just reiterate that is we are supposed to have stress. We as animals are supposed to be responding to stress. It's when we get caught up in chronic stress and chronic fight or flight or sympathetic nervous system that the body prioritizes sort of keeping you in the safety of fight or flight response, and then down regulates the autonomic, which includes hormone regulation. And so what we'll see is women who are chronically stuck up in fight or flight will start to show signs and symptoms of hormone dysregulation because the body is prioritizing getting away from the bear that's chasing them, right? And so cycles will change and respond to stress, and the hormones will stop flowing in a way that's optimizing their fertility, which is at the heart of sort of us as animals. Like reproduction is a priority on the autonomic side. So how does acupuncture help with that? Acupuncture is really good at and has been studied under functional MRI at regulating into this deep rest state. They're not exactly sure how it happens, but what they can see is that when acupuncture needles are inserted, that the brain responds. And so endorphins go up and your sympathetic nervous response goes down. We can explain it in Eastern medicine, and in terms of like I sort of spoke on earlier, in bringing the organs back into optimization. But it honestly doesn't really matter. What matters is that it works, and that even patients who have brought in their aura rings have told me that during their acupuncture session, they go into that really deep meditative sleep state, and that they don't even get when they're sleeping. And so acupuncture brings down the sympathetic nervous system, brings up the rest and digest half of the nervous system. And with that, then the hormones can cascade down from the brain to the ovaries and uterus and function well and fully to their full potential.
That's a great explanation. Thank you. I love that. So I'm assuming that this is happening on a more chronic basis rather than acute. Is that correct? Because I know, like, when I've done acupuncture in the past, that I felt a little bit stressed when I had needles in me. Like, I felt a little bit like I was in a stressed state, but then eventually you kind of come down from that, like, initial stressed feeling. Maybe not everyone experiences that. Maybe that was just like my initial reaction. But would you say that we see this more on, like, after someone's been doing acupuncture for like a couple sessions or a couple months, that they start to see these improvements, or do you see that it's a little bit more immediate?
Yeah, we see it immediately. So it really depends on your practitioner. So I hate to say that, but when you go to a dentist you don't stop going to the dentist. Do you know what I mean? Like, you find someone that fits you. And I would say that the approach of acupuncture that was taken with you was probably not right for you. So what we like to do is make sure that everyone who gets on the table is comfortable, because that's part of the healing process, to come out of the fight or flight, right? So we use the highest quality needles. They are so tiny that you barely feel it, like, if at all. You know, a lot of people come into acupuncture, they're like, I'm going to try magic. I don't know what this is. You know, I don't like needles, but I'm going to give it a shot. And we really prioritize making sure that it's not a stress response situation. And so good needling technique, good quality needles, really explaining what's going on really helps to bring down the guard. And that is part of the regulating and healing process. So I don't mean to, like, talk down down on your acupuncture experience or your acupuncturist, but I would say try it again with a different practitioner. You'll probably have a different response.
Well, thank you for explaining that. I think that'll be helpful for anyone who may be listening who's had that same experience, because I'm sure there's other people outside of just me, right? And I think it's also that, like, feeling of, like you said, what the heck is happening, and a little bit of that, like, reactivity that can happen, right, when you're uncertain. So that's amazing to understand a little bit more. So thank you. Ghoncheh, I have a question for you just about, a lot of our patients that we work with, we mainly specialize in thyroid and hormone imbalances. So, hypothyroidism, Hashimoto's, PCOS are a lot of what our listeners are experiencing, what they've been diagnosed with, or maybe they're having symptoms that correlate with these, and then a diagnosis later comes. And it's impacting their periods. And they might be having either no period, or they're having just total irregularity, or maybe even anovulatory cycles where bleeding, but there's no ovulation, so they're having difficulty conceiving, maybe one issue that might be going on. So can you tell us a little bit about how acupuncture can help with this type of situation, where there might be missing periods, or where there might be irregular periods where there's no ovulation happening?
What we look at is first, what's the underlying cause of their irregular periods? And regardless of what the underlying cause is, and I'll get to what some of those are in just a moment, is that acupuncture works on that brain ovarian hormone communication pathway. And so by turning on how the brain communicates in with the ovaries, by increasing circulation, where the hormones are able to flow freely through the bloodstream from the brain to the ovaries, then back to the brain and around again, that is able to turn on the ovulatory process and regulate cycles. Now, it really depends also on what they're coming in for, the exact mechanism of acupuncture. So, for example, if they are ovulatory because they have PCOS, then acupuncture is going to work to support healthy insulin levels and to support the function of the pancreas in keeping insulin regulated. If they're coming in for hypothalamic amenorrhea, and that's why they're not ovulating, that's why they're not cycling, our goal with acupuncture is to take them out of that fight or flight state. Because with people with HA, they are often, maybe have a history of like athleticism, a history of like dieting, not getting enough calories. And so what we do with acupuncture in that case is to take them out of that flight or fight state, reduce cortisol, and able to signal to their nervous system like, hey, you're safe, it's okay. And then that hormonal communication pathway, the HPO axis, is able to then turn on and regulate. If in the case of hypothyroidism that's leading to irregular or weak ovulation, the way that we're seeing it clinically with hypothyroidism is that there's often a high incidence of luteal phase defect, where there's not enough progesterone to stabilize and hold the uterine lining. So the luteal phase ends up being shorter than what we'd like to see. We'd like to see it closer to 14 days. So with acupuncture, in this case, it's really able to support that follicular development and give the cells enough energy to really build that follicular development more robustly, which ends up leading to more robust ovulation. If ovulation is strong, then that corpus luteum, that empty follicle that had the egg that was then ovulated, is able to then secrete more healthy progesterone levels. So, at its root, acupuncture is really working on this system, no matter kind of what the cause of their irregular cycles are, but we also want to treat them based off of their presenting signs and symptoms as well.
That's awesome. And it sounds really similar to how we work on the nutrition angle, is really identifying like, why is this happening, right? And then using food as the tool to be able to support the imbalance. So I love that the mechanism of how both acupuncture and nutrition work are so similar in terms of their influence. I'm curious in terms of more of like the like manual side of it. Does that dictate where the needles go? If someone is maybe like, if you're trying to improve insulin versus if you're trying to, restore the hypothyroidism causing their regular periods?
The answer is yes. So the points are really dependent on what we're working on. So if insulin resistance is at play and they are the kind of the more typical type of PCOS, then we're going to do the acupuncture points on pathways that stimulate the metabolism. So there's certain acupuncture pathways that work on a more metabolic basis. And if they are coming in for kind of lower hormonal functioning, think like kind of more HA, hypothalamic functioning, then we are going to work to stimulate the pituitary gland. There's a point behind the ears, an acupuncture point that goes kind of directly to the pituitary gland. There's points in the ears that stimulate the vagus nerve, which again helps all the organs go back to their homeostasis. And so again, if they're coming in and they have night sweats versus constipation versus kind of loose stool, we're looking at all of these in conjunction with their Western diagnosis and treating them for where they are. So we'll do a lot of kind of points depending on what that presents.
Got it. Okay. And if someone is coming in and they don't know the cause as to why they're experiencing irregular periods or infertility, then what does that look like? I mean, I'm assuming you're doing an assessment. Are you asking questions? Are you doing testing? How do you determine what's necessary for their treatment?
Yeah, absolutely. So that's our job to figure out. And people come in and they're really stressed and they're like, I don't know what's going on. And we're like, leave it to us. So in the first initial visit, we have all of our patients start on some basic cycle day 3, like fertility testing. We'll have them run their labs. If there's any kind of diagnostic or imaging that they have done, we'll take that into account. But we also just get to know them as a person. How's your sleep? How many hours are you getting? Are you waking up in the night feeling anxious? Or do you get gas or bloating, or do you tend to run hot or cold? So these types of questions in terms of their overall well-being give us a sense of what their diagnosis looks like from like an Eastern perspective. And like we were talking about, we really work from an integrative perspective. So we will also help the patient advocate for themselves to make sure they're getting the right types of testing done, and then we will make sense of it all for them.
Awesome. Thank you. That's a great explanation. Okay, Emily, question for you just in terms of, we talked a little bit about like the mechanism of how some of this works, right? And I love that explanation of with like hypothyroidism, how there could be luteal phase defects. And I feel like a lot of women don't even know that that's a thing, right? And maybe they're starting to learn this because they're using their Aura rings and they're like, okay, I'm pairing my natural cycles. I'm seeing that I'm getting this temp spike, and it's dropping. What's happening? And that's how we're able to like really deduce that like, okay, this is probably luteal phase defect that's going on even without progesterone testing, right? But say in the case of like PCOS, say that it's not insulin resistant PCOS, because sometimes that does happen. And say that maybe it's like Hashimoto's, they have an autoimmunity that's causing their irregular cycles, or that their adrenals are mainly responsible for driving the high amount of androgens. What does the treatment look like for someone who might be in that type of situation?
Yeah. So the really cool thing about Eastern medicine is that someone who comes in with Hashimoto's and another person who comes in with Hashimoto's, we won't treat the same. So over the course of 1,000 years, the Chinese really looked at symptoms and grouped them together and said these symptoms are a dysfunction of this organ's heat or energy, qi, going back to our first question. And so someone who comes in with Hashimoto's or PCOS may present with a group of symptoms that tells us that their spleen energy, their spleen heat is deficient. And so we'll pick points along the spleen pathway to increase the spleen's function. This is getting like really into deep Eastern medical theory, versus someone who comes in with PCOS or Hashimoto's, pick your diagnoses, right? And they have night sweating, and they have flushing to their face, and they have redness and dry skin. We will group those symptoms together and look at maybe the kidneys heat, right? Not the kidney, you don't have like damaged kidneys, but the heat coming off of the organ is somehow deficient or in excess. And so we will treat along the kidney channel. And so our care is really curated to who's in front of us versus Western medical diagnoses. Of course, it's integrative. So patients who have PCOS tend to have similar symptoms, but if there's something that doesn't quite align with, the common symptoms of PCOS, then we sort of move the needle towards what their body is telling us they need. Does that make sense? Yeah. But to give you a sort of shorter answer, Hashimoto's is autoimmune, which means it's in Chinese medicine, it's a deficient heat. In Chinese medicine, there's yin and there's yang. We call it yang. America calls it yang. Okay. So yin are things in the body that are substance. So blood, the things in the body that are cooling, it's organs. And then there are things in the body that's yang. And so that's heat, that's effervescence, that's energy. And so you should be in balance. You should have the same amount of yin as you do yang. When you have symptoms, you can have an excess of heat, okay? And those show up as like literal heat signs, like sweating, usually things that you associate with like a virus, okay? Fast heartbeat, the actual sensation of heat. But But for autoimmune, which is where we'll turn back to, it's a deficiency of yin. So your yin or your cooling ability goes down. And so you're actually feeling heat, but the pathway, the mechanism is a deficiency of cooling. Okay. And so autoimmunity tends to show up as like heat symptoms. So rash and flushing and night sweating. And so we work in as Chinese medical with Chinese medical theory running in the background to build up your yin versus bring down actual heat. So bring up your cooling system. So that's deep, and now you're an acupuncturist.
No, I love it. And I know our listeners will love it too. It gives so much explanation to how this works. So I appreciate it because I think that a lot of Eastern medicine, functional medicine is just like so different than what most people are used to, right? So the more that we can explain the why of how these things work, it helps the listener who's very, maybe grown up or lived most of their life in the Western medical system, right? So thank you for providing that explanation. So another question I have is we've talked a little bit about these health conditions like PCOS and hypothyroidism and such. But what if someone who is, maybe doesn't have any of these conditions or maybe does, but they've just come off birth control and they are dealing with like what we call not really a diagnosis, right? But kind of this syndrome of like post-birth control syndrome where they haven't had a period. It's been several months and maybe they're starting to deal with a lot of like acne and a lot of these residual symptoms of coming off of birth control. Is there a different way that acupuncture works in someone's situation that's coming off an oral contraceptive or has gotten their IUD out versus someone who has something like PCOS or hypothalamic amenorrhea?
Great question. They're so thoughtful. So with someone who's coming off of the pill, if someone's on birth control, any form of birth control, what it functions as is a cap on the ovarian response. It is essentially shutting down the communication pathway between the brain and the ovaries. So when coming off of birth control, our main goal or treatment strategy with acupuncture is to turn that pathway on again. So the topic of coming off of birth control can be really charged in the wellness space. There's a lot of, I think a lot of people can feel like guilt in being on it or coming off of it. We really want our listeners to know that wherever they are with their post-pill journey, we're here to support them. And acupuncture is incredible. It's unlike really any other therapy in terms of regulating their cycle. Because what can happen is there can be kind of for lack of a better word, a stall in how the brain and ovaries are communicating. So we are going to work to kind of get that back up and going again. And acupuncture is really great at supporting that process. So it sounds redundant. We just kind of keep coming back to the same thing, but that's really at the root of what we're working on with acupuncture.
Yeah, so it all comes back to that brain to thyroid, brain to ovary connection, right? That HPT, HPO axis, it sounds like, with a lot of these types of situations, which is wonderful. That's the mechanism that acupuncture is supporting is so similar, but it sounds like there's still a ton of minutia and differences within each of these different situations. So thank you for providing explanation on that. One of our listeners submitted a question regarding painful periods in terms of having just a ton of pain the first 1 to 3 days, lots of cramping, just a lot of these PMS symptoms. Can acupuncture support painful periods, or because someone's already menstruating, they're already ovulating, maybe it doesn't seem to be as effective?
Yeah, so with painful periods, we want to know that it's common, but it's not normal. So pain is always a sign from the body that there are systems that aren't functioning as they should. With painful periods, there's a hormone-like messenger called prostaglandins, which are their job in the body is to cause muscle contractions and create blood clots and dilate blood vessels. They work on a very technical basis. With painful periods, they are often high in prostaglandins, and that presents as high inflammation. And so what acupuncture is really well known for, and this is like across so many different kind of subspecialties of acupuncture, is that it's really well known for reducing prostaglandins and reducing the inflammation that causes painful periods. So that's a really big area. And so also on the flip side of that, by reducing prostaglandins that reduce the inflammation causing painful periods, is that acupuncture is great at increasing endorphins. And so endorphins are the body's natural painkillers. And so by stimulating that process, the body's natural ability to reduce pain and reducing the inflammation associated with high prostaglandins, the menstrual period can and should be relatively symptom free. Ideally, it's not that way for a lot of people, but we want our listeners to know that it's absolutely attainable. If you have painful periods, it's not your lot in life. Come in and get acupuncture because we can fix that with relative ease, and there's a lot of research to back this up.
And would that be something where it, again, is like an acute response where they come in the day before they expect their period's going to come, and then that's what's helping to be able to lower that prostaglandin response because they're absolutely elevated in that time period leading up to you starting your period, right? Or are you seeing that when people are getting acupuncture regularly, that it's actually helping with lowering the prostaglandin production in future cycles?
Yeah, so it's both. We have patients who come in and they're like on their period and they're like, man, I'm cramping really hard right now. I'm at a 7 out of 10. My pain is really bad. And they get off the table and they're like, I have no cramps at all, or I'm at like a 1 or a 2. So very much in the acute phase, but then also that our acupuncture treatments are cumulative and that they build off of one another. So patients will notice that over the course of like several weeks or months that their painful periods have come down in terms of their intensity, and as a result their fertility is also improved, because the menstrual cycle is seen as kind of like the fifth vital sign, so it tells us a lot about how our fertility is. So when there's less painful periods, then we know that circulation is optimal and that the hormones are able to get to where they need to go.
Wonderful. Okay. Thank you for providing that explanation. So I want to talk a little bit about how the treatment for acupuncture would differ if someone is trying to get pregnant versus they are pregnant, right? And maybe this even differs depending off of what trimester you're in. So I believe, Ghoncheh, that you wanted to take this question, right, and provide a little bit of explanation on this. But could you just break down for us what those differences might look like for someone?
Totally. Yeah. So with fertility acupuncture, going back to that HPO axis, that hormone signaling cascade, and we're also going to treat them based off where they are in their cycle. So in the first half of the cycle, in the follicular phase, we are really drawing lots of circulation to the ovaries, and so that those hormones can get to where they need to go, and to help increase the receptors on the ovaries responding to FSH, which comes down from the pituitary gland. In the luteal phase, because there's always a potential for pregnancy, we're always going to treat them as if they could be pregnant and avoid certain acupuncture points that are contraindicated in pregnancy that have more of a stronger, kind of more invigorating moving function than we'd prefer to have in the luteal phase when like implantation could be occurring. So during that luteal phase, we are more kind of in that supporting, holding pattern as opposed to like moving, strongly moving. So that's kind of what we're doing with fertility acupuncture. With pregnancy, our main treatment strategy is to strengthen the body's constitution. Pregnancy is hard on the body. No matter what kind of state you're coming into, it's hard on all systems on the body. That's just like biologically normal. So our goal is really to make it as easeful on the body as possible, strengthen the body's natural ability to be strong and resilient in the face of this demand on all the systems, reduce a lot of the common symptoms of pregnancy from the first trimester all the way through the end of pregnancy. So we're talking about things like nausea, gestational diabetes. If they have something more severe like hyperemesis gravidarum, it could support in that. If they have placenta previa, breech positioning is a big area where acupuncture and moxibustion can like really shine. So we love reaching people in that kind of preconception stage at fertility all the way through pregnancy and then postpartum as well. With our acupuncture and pregnancy treatment program, we really recommend people coming in weekly through the first trimester. And that's, again, to strengthen that body's natural constitution, reduce some of the common discomforts. Then they're going to be feeling pretty good throughout the second trimester. We recommend them coming in monthly for tune-ups or check-ins, and then coming back in weekly starting at 36 weeks to get them prepped for labor, or earlier if there's breech positioning. So the treatment strategy differs, but all in all, it feels pretty good, and most people like the extra relaxation.
Yeah, I'm sure it's a good little break for them during the day, right? Little self-care. So I love that. Okay, so we talked a little bit about how acupuncture supports fertility, and you mentioned a little bit about the role of the nervous system and some things about blood flow. And I want to talk a little bit more about just, some more specifics as it relates to blood flow and ovarian environment, and maybe even egg quality that might come into this conversation. And what is acupuncture doing that's helping to create a better, healthier ovarian environment?
So this is really at the heart of what we do. So there are 3 ways that we support and treat someone in their come up in fertility. The first is hormone regulation, which we have gone over, the communication from the brain to the ovaries through blood flow and getting those hormones to hit the ovaries. The second is egg quality. And so egg quality is a function of the cellular environment, the toxins around the cells, the inflammation around those cells, and the hormones hitting the egg development. As we've listened to on your podcast before, there's really a 90-day development cycle where the egg cell is going from a set of chromosomes down to one set of chromosomes so that it can meet the sperm chromosome and become a viable embryo. In that cellular division is where we can find the quality of the eggs be hindered by the cell's environment. And so, what acupuncture does in the 90 days leading up to ovulation is it helps the egg cells' energy, its ATP, function better so that it can divide chromosomes in an optimal way. It helps clear out toxins and also inflammation. And not only acupuncture, but what we also do is coach people through their lifestyle redesign to take out the toxins that may be affecting egg quality. A lot of women think that as they just get older, their egg quality just declines over like 30 or 40 years. But in actuality, there's this really amazing way that women can affect the quality of their eggs within this 90-day period. So, like from primordial follicle, a cohort of eggs starts the division of chromosomes and then reaches full ovulation over that course. And it's really that 3-month period that you can influence your eggs. And so there's real opportunity. People just think, oh, hey, I'm 41 and that's it. Like I can't influence what's happening in my fertility and my equality process. But there is a huge amount of things that you can do. So we get people on supplements that support cellular ATP, that clear toxins, that bring up antioxidant ability, and then we also provide them with guidance and lifestyle changes that can influence the chromosomal division in a way that's really concrete. And so we see this really amazing magical month in acupuncture where it's the 4th cycle that we've brought our fertility patients through, where we have a really increased success rate for pregnancy because we've been influencing their egg development from the primordial follicle all the way through chromosomal separation. And then that egg is ovulated with having been influenced over the course of this 90 days. So that 4th cycle that someone comes in, we have to coach them through getting their period over, 3 months. But that 4th cycle, we know that they're going to come in and they're going to be like, I'm pregnant. It's really fun to anticipate that happening. And then thirdly, we can, in the implantation period, we can influence the uterine environment. So there are things there are reasons why someone may not be getting pregnant because of the uterine environment and not egg quality or hormone regulation. And that includes polyps, that includes scar tissue, that includes adhesions. And acupuncture, moxibustion, and other modalities can help to reduce polyp formation, reduce adhesions, and help the lining of the uterus grow to a point and decrease its inflammation in order to receive a viable embryo. Because sometimes it's just the reception that is off, including the ability of progesterone to stabilize the lining. So we're doing a lot. There's a lot of thought behind each patient and meeting them where they are in their fertility journey. There's a ton of education. When you come in, if you're a type A, which a lot of our patients are, like if you're looking for a plan, we've got one. And this is why we see so much success, because we've really put together all of the pathways where fertility can be influenced to get you to that healthy, happy baby.
Wonderful. I love that. And it's really similar to like how our process works is people always think like, oh, it's just going to be like one plan and then like I'm good. Like once I understand what I should be doing, then I'm good. And it's like, no, each step, like each session, I have like a master plan in my mind of like what we're building on, right? Like every step continues to build upon one another. And sometimes it's hard for the patient to like see that and understand that, right? But we have that master plan in the back of our head where we know what's guiding the treatment, right? And it's organized. We've got it all under control. Like we've got you covered, type A girls. So I love that. And that's really, really helpful to understand about the egg quality. And I'm glad you brought that up too, because I do think that that is a very common misconception for women. And I think it's also why a lot of women do egg freezing, right? Because that's an option nowadays, is because there is so much fear around that and about that egg quality dropping as they get older. And I love that you're reassuring women that there's actually a ton of factors in our influence that can help really be able to extend that egg quality way beyond where women think that they can go. So yeah, that's awesome. Thank you for sharing that. Okay, so I want to just talk a little bit. You guys have shared so much about your process for how you're working with your patients, and maybe you can just talk us through a little bit more in terms of like what that timeline looks like. And I know you mentioned, Ghoncheh, with like if they are pregnant, that the frequency of when they're coming in might differ based off of where they are in pregnancy. But could you just give us a brief overview for someone that's dealing with period problems specifically? What does that treatment timeline look like, treatment frequency?
Yeah, absolutely. So the hormones change every week. There's four main hormones to the cycle. We have FSH, we have estrogen, we have LH, and then we have progesterone. And they really each have their own function per week. You can sort of divide it into weeks. So we like to see everyone, especially in the acute phase, weekly, because then the first week after, during the period, we're influencing estrogen and follicular development, and then the second week is we're influencing the growth of that follicle, and then LH spiking and ovulation happening. Then in the third and fourth week, we're helping to lift progesterone and the body's response to progesterone in your lining. And so we really need to touch each one of those hormones and the connection from the brain to the ovaries in those weekly sort of surges of hormones. So where we see the most success is when people really commit to coming weekly. And what was, especially for period problems, and not just fertility, but period problems and issues, what we'll see is the body will regulate over, I would say, 3 cycles. And then you won't have to come back. This is not like, oh, I got to go every month and I got to be on a plan for the rest of my life. The body just has to learn how to communicate. You have to learn what you can do outside of acupuncture to influence your brain ovary connection. And then really, you're home free. So for period and cycle issues, let's say over the course of 3 months, once weekly. For fertility, it depends on how you present. It could be, we get you pregnant in 1 cycle. Those are the amazing cases. That's just hormone regulation. And if it goes deeper, like there's, some sort of chronic disease going on, it may take 6 months. But the great thing about that is that all we need is a pregnancy. And so, you get there, we get you there in 6 months for, let's say, PCOS patients, and then you're one of our pregnant patients, and you go home and you have the family that you've always wanted. So it's not forever. And I think people get worried that they're going to have to sort of go to treatment forever, and that's not the case for us. We're here to just support you until your body can do it itself.
And what about for someone who, has, maybe they're not trying to get pregnant, right? And they have something like PCOS and they're just trying to manage their PCOS better. is there a maintenance plan that would be recommended for acupuncture? Would it be like once per month, or are you looking at, okay, this month they're dealing with anovulatory cycles, so I want you to come in when you're ovulating, versus like last month you were dealing with really heavy periods, so I want you to come in whenever you're about to start your period? Like, does that differ based off of what their maintenance plan looks like?
Yeah, so we like to get the bodies to the point where there's not a maintenance plan. Like that's the special part about acupuncture, is that it may take work and it may take education, but if we get you on, for PCOS in particular, let's say we help you understand insulin dysregulation and you're on inositol and you're on berberine and we've provided that information for you, and all of a sudden your cycles become regular with acupuncture and supplements, and we also teach you about how to regulate your glucose, then in theory, right, your cycle should regulate. Okay, if you're taking the education that we're giving you, you have the acupuncture to influence, you have the nutritional advice, and you're implementing them, then we don't see necessarily a reason for you to have a maintenance plan. Yes, if all of a sudden you find that you've gone on vacation and then you haven't really gotten back on your plan, and you want to restart like your regimen towards regular cycles, then come back in and we'll get you there. We'll plan it all out for you. But if through education and some really disciplined lifestyle redesign, we feel like we can get you to a place where you can manage and cultivate well-being.
Love that. Okay, wonderful. So I want to hear a little bit more. I know you guys are expanding Aphrodite really soon here, and I want to just learn a little bit more about what's to come for the future, if you can share any of that, and just a little bit more about where Aphrodite is located, how someone can learn more about working with you guys.
Yes, we are so excited. So we are expanding into a much larger, gorgeous space in Bankers Hill neighborhood of San Diego, just a few blocks down the street from where we are now. And you can find us there starting in March, but we are still currently accepting new patients at our current space. So we're going to, in this new space, probably the thing that we're most excited about is we're going to be opening a fertility fitness studio and have Pilates and yoga and other types of fitness classes to really build community within the Women's Health Network. Even if you're not trying to conceive, we really want to build this this network. And so that's coming. You can find us at aphroditefertility.com. You can find us on social at Aphrodite Fertility. And what else? Oh, yeah. We are coming out with an online course on 10 ways to influence egg quality. And these are some of the main ways that we talk about in our treatments with patients. So if you are, especially if you're like an out of towner, you can't come in with treatment for us, hop on this course, because you're going to hear about the stuff that we talk about with our patients. So we're really excited to have that out and can't wait to have you in our space.
Wonderful. Thank you so much for your time today. It's been so wonderful talking with you and really just learning more about the science behind acupuncture. I know that everyone will love it. So thank you again.